Caregiver crisis. I'm Corey Venturi, and I'll be moderating today's discussion, which will run about 45 minutes. This session is part of the Great Challenges program sponsored by the Robert Wood Johnson Foundation. The goal of the Great Challenges program is to look at 20 of the most complex problems in health and medicine, issues that can't be solved with a magic bullet or a one-shot cure or policy. Our mission is not to solve these issues, but to share ideas from many disciplines to reach a better understanding of them than we had before. We'll be taking questions from viewers. We've received some already, but we'll be taking questions on Google Hangout and on Facebook and Twitter. That's Twitter at TEDMED, T-E-D-M-E-D. Just tag your questions with a hashtag Great Challenges, and we'll try to get to them. As mentioned before, my name is Corey Venturi, and TEDMED has asked me to moderate today's event. I'm a medical journalist who's been writing about science and health and medicine for a couple of decades now, covering laboratory research, clinical medicine, and patient issues. I like to ask questions, so that's why I'm here today. We're very lucky today to have a terrific team of 5 experts who we call our challenge team to lead the discussion on this topic. What I'll do now is ask our team members to introduce themselves, starting with Alan. Alan Blaustein, please introduce yourself.
Corey, thanks for having us today, and TEDMED, thanks for everything that you've done. My name is Alan Blaustein. I'm a founder of a company by the name Care Planners, which is involved in the caregiving crisis because we help caregivers better navigate the throes of the healthcare arena when you're going through issues with yourself or a family member or a parent or whatnot, and we're just thrilled to be part of the conversation.
Okay, how about Carol Levine? Can you tell us about yourself?
Hi, thank you for inviting me to do this. I'm Carol Levine. I direct the Families and Healthcare Project at the United Hospital Fund in New York City. And we work on developing partnerships between healthcare professionals and family caregivers, especially during times of transition from one care setting to another.
Thank you, Carol. Can Sherry Latimer please introduce yourself?
Thank you so much. This is Sherry Latimer. I am the CEO and President of Consulting Management Innovators, and it is my honor to serve as the Executive Director for the National Transitions of Care Coalition and the Case Management Society of America. And thank you so much for asking me to be with you today.
Thank you. And Suzanne Geffen-Mintz, please.
Hi, I'm Suzanne Mintz. I am a co-founder and CEO Emeritus of the National Family Caregivers Association. I was honored to be selected to be the advocate for the Caregiver Challenge at TEDMED 2012, and I'm so happy to be with you today. NFCA is the nation's family caregiver organization, reaching out to caregivers across the lifespan, across all disease states and relationships.
Thank you, Suzanne. We lost Barry Jacobs, but when he comes back on, we'll introduce him. So I'm going to start us off with a statistic. It's estimated that 44 million people provide full-time or part-time care. People getting care range from the sick and the elderly to new mothers, disabled veterans, and the mentally ill. So our first question I'm going to pose to Alan, please. The question is, what is the top contributing factor for the Great Challenge, the caregiver crisis? Alan?
I just think, frankly, we all know what most of the issues that we're dealing with are, right? The aging population, the healthcare system not really being in a position to take care of everyone, people getting busier, living further away from other family members, and a real need that we have for better coordination of care in the marketplace. I think the real issue and the real contributing factor, or the factor that is not me, by the way. I think I just won Powerball. I'm not quite sure, but maybe I did. I'm sorry, let that pass. The issue at hand really is that there's nobody in this system who's in any position to properly caregive or coordinate care for any member of your family or extended family. Therefore, the responsibility is borne by yourself and myself, and we're getting older, we're living further away from family, and it's becoming a bigger issue.
Thank you. I see that Barry Jacobs just joined us again. So Barry, please introduce yourself. Oh, you're gone again. Sorry about that. We're going to move on to the next question. This is a question that came in from Twitter. Why don't more people have advanced directives? Let's talk about how you want to live the rest of your life. Carol, would you like to answer that one?
Sure. This is a very common question. I think a lot of people have a kind of magical thinking. If I don't think about an advance directive, I won't need it. I will live forever. And so it's an avoidance of something that's not easy to talk about. I have found that most people, when you talk about it as a normal process, as a normal responsibility, not as some sort of great, huge choice to be made, people can do that. People can do it together. And often if young adult children talk to their elderly parents by saying, you know, I just completed an advance directive. How about we talk about that for you? It takes it away from this, oh my God, my parent is getting older, we have to do this right away. So normalizing it helps.
That's great. Anybody else here have suggestions on how to make advance directives more commonplace?
Yes, this is Suzanne. I think if we tie them to the power of attorney, the medical power of attorney, and don't get into all of the details about exactly what we want to have happen at certain stages of our illness, but that if we leave it up to the surrogate person to do what I want, it's less scary, and I'm not sure we can all know exactly what it is we would want in a situation that none of us have ever been in before. So the less specific makes it less scary for people to do, and then people can just talk about scenarios but not necessarily have that be part of the legal document.
Thank you. We've got another question. What strategies can reduce the exploitation of paid caregivers who are predominantly low-wage, non-unionized women, minorities, and immigrants? Sherry, would you like to handle that?
Thank you. I think that it's a joint and, if you will, bidirectional discussion that needs to happen. First of all, that our paid caregivers are actually given great training and help to develop those skill sets so that they also feel very comfortable in being able to discuss what it is they can provide and how they can provide it. But it also comes back to the patient and the family caregiver, that they know how to really interview and ask a paid caregiver what services they can provide, how they provide that, what training that they've had, so that together they make a joint decision that is mutually benefit both parties, both the caregiver and the family as they're going forward. I often feel that this is one of those areas where we just don't have the skill set for the patient and the family caregiver to really be able to interview and ask those right questions. So I think we need some training on both sides, and I think we should be willing to provide that.
Thank you. Anybody else have comments on paid caregivers?
I do. This is Carol. I think the way the question is worded is a little biased, in the sense that thinking that all paid caregivers are inherently being exploited. Certainly there are situations in which that is true, but I think that we all understand that this is a low-paying job. It should have better pay. It should have benefits.
It's all coming.
It should have a career ladder. But on the other hand, there are it is a as was said, it is a joint involvement, and a lot of the employers are home care agencies or nursing homes, so they have a responsibility too to select the people well, to train them well. So I think that it's not so easy to answer that question.
Thank you. I hear that Barry's back. So Barry Jacobs, can you introduce yourself for us, please?
Oh, he's muted. He's having trouble.
You might be muted.
Yeah, he's having trouble, so I'm going to walk him.
Okay, hold on a second. We're gonna help you out and go to the next question. We've got a question from Facebook user Yuna Jung. What do you think of the term caregiver? Can we shift it to another term? Alan, would you like to address this question?
Yeah, I'm not sure it's a bad term. So you can shift it, but I have found with any type of branding exercise, including calling yourself a caregiver, if the fact is that you're giving care, I'm not so sure what else to call it, so I don't mean to punt on the question. If anybody else has a better suggestion of whether we should name it Fred or Bob, I'm happy to follow that. But I don't know what's wrong with the concept of caregiver.
Well, this is Carol. Suzanne has been talking about this. And
I'm going to get yelled at.
we started in this, the way this came about was that the research world, the policy world used the term informal caregivers to distinguish them from the formal home care agency provided workers. So Suzanne, I know, has been a very forceful advocate for not using the term informal, because it isn't informal, it's very hard work. I think family caregiver works as well as anything I know of. People have suggested care partner. That works in some situations, not in all. I think sometimes the talk about what to call it is an avoidance of dealing with the reality that this is what you're doing. But again, you know, who has better ideas? We can talk about that.
Yeah. I think at this point, this is Suzanne, that at this point, the term family caregiver is pretty well entrenched to refer to anybody whom the person needing care thinks of as family. So whether it is blood family, legal family, whether it is your next door neighbor, it's the person with whom there is an emotional connection who's providing care for you. But moving to change things would just complicate the issue at this point, and I think having the adjectives really help people understand who's being referred to.
Okay, we've got another question from a Google Plus user, Lisa Fields. She asks, what practical wisdom would you offer for those who are just beginning the implementation of educational and support programs for individuals caring for loved ones with chronic illness and dementia? Sherry, would you like to talk about that?
Be happy to. Many of us, both as providers of care and as family caregivers for our own families, need to understand what are the concerns that we're dealing with. And I think if we're providing an educational program, we need to be able to ask of that group what are some of their needs and what are the processes that they need to feel that they've got the support, feel confident that they are able to provide those services, and definitely to be able to ask the questions. Part of the issue that we often deal with is resources. What resources and tools are available for families and for caregivers? And many of us that are on this particular presentation have many resources that are available, making that available and helping folks know that. But one of the key things for me in providing these services is that we are talking in the health literacy that patients and consumers can understand. As providers of care, we often go beyond that into medical terminology, which is pretty difficult for most of our consumers to understand. So I think that's one of the considerations that we absolutely should be putting into place as we develop those programs. And I would say that one of the best educational programs is to have multiple folks that are dealing with those problems together.
I thought maybe Suzanne might want to say something about this topic as well.
Yes, I would. Thank you. When designing programs for family caregivers, we need to be very cognizant of language. Family caregivers hear an awful lot of shoulds, and you have to, and you've got to come at the conversation, come at the wording of a program from the perspective of the family caregiver, from the perspective of somebody who is doing this. And so words like should not should not be used. Suggesting things is better than ordering things. And I would advise anybody who is trying to put together a program to have an advisory board of family caregivers.
Thank you. Okay, I'm going to move on to the next question, which asks, can we expect employers to create a flexible work environment so that employees who are also family caregivers can balance their sometimes conflicting roles? If so, what would this flexible work environment look like? Sherry, any ideas on that?
I'd like to speak to that from actually being an employer. We do here support our employees when we have issues around healthcare and family members. And when we talk about flexible hours, we talk about how we might be able to accommodate that schedule. Do they need to work from home? Does remote work for what they are actually looking at? Do they need additional time off? Do their hours need to be flexible? How does that fit into place? And for myself as the employer, I look at it on that individual basis, and it is my commitment to support my employees with the things that they need. I think one of the things that is more difficult is we don't see that across the industry. But as we know the amount of individuals that provide this care, I think it's something that we have to consider because we depend so heavily on these individuals to provide that. And I think we have to look at it from when they are at work and these things are not being addressed appropriately from their perspective. Is that really a productive employee, or are there other things that we can do to help them? So I have very strong support about having that in place, and I think it's something that we need to work on as an industry to ensure that we can provide that.
Thank you. Any comments from any of our other members on that topic of employer flexibility?
I'd actually like to, sorry, after you, Carol.
Go ahead. No, Alan, go ahead.
Go ahead, Alan.
All right, I will. I will take this. I think one of the big problems is that most employers, I wouldn't say, I don't know, many employers, especially small employers, are not as well informed as Sherry. And caregivers are very reluctant to talk about their caregiving responsibilities in the workplace because they're afraid, particularly in times of fiscal crisis. You don't want to raise issues. So what one needs to start out with is not only leadership from the top, but leadership at a supervisory level. It's not necessarily the president of the company who may have a wonderful policy in place. It's the middle manager who is really going to be determining whether, you know, this employee is taking too much time off, talking too much on the telephone, going to say, well, gee, we can't really send this person up for another training because they're not doing this. So it's got to be through the organization and an understanding that there is a need to be flexible. And in truth, some industries can be more flexible than others. Some industries you can't work at home. Hospital nurses don't work at home. They work in the hospital. So I think we have to come up with tailored solutions to each industry and in each setting.
This is Sherry again. I just want to add to that because Carol, both you and Suzanne know how strongly I believe in this. One of the things we do at CMI is because we have a paid time off bank, all of our employees know that they can dedicate any hours they don't use to a general bank, which we allocate to individuals that are really struggling with family caregiving or catastrophic processes. That's just an example of how we can use some of the flexibility that we have as employers to really help folks through this and to not make it feel like it is such a threat for folks to be able to talk about what they're dealing with. So couldn't agree more with what Carol said, but I also want to give an example of how we can use some of what we do in business every single day to help support our family caregivers.
Okay, it's Alan. I'm jumping in now.
Good.
I'm jumping in.
Good.
I think I think if we were having this conversation 10 years from now, the work-life balance issues related to family caregiving will be somewhat better settled. I think this is really the work-life employer challenge of the next decade to get this right. I think you've dealt with it in other decades when you had a dual family workforce and you tried to deal with maternity leave and then paternity leave. I think as the population ages, it gives a natural issue to a broader set of folks in the community. And I think employers are going to have to deal with it. And I think to the points already made, every industry will deal with it differently. But a decade from now, we're going to all be in a slightly different place. This is really the challenge of the next decade for the employer workforce.
Large employers are already addressing the issue, and they recognize that it's their bottom line that is at stake. And so it's a combination of wanting to help employees, but recognizing that their business depends on it as well. And it is easier for large employers to deal with it. But there's definitely been movement on that front, and I agree with Alan that as time passes, the solutions will be more apparent.
A question that just came in from Twitter from Mike Moore. Question is, what can we do to help medical nursing students understand the challenges that caregivers face? It's a great question.
Sure is.
Suzanne, you want to take that?
I do. There was an interesting article, excuse me, yesterday in the Washington Post, in the health section, which you can find online, which was written by a nurse who was the dean at a nursing school, who had just gone through a horrific transition issue. Her husband had had a stroke away on a business trip, and so there was this whole process of getting him home. And here is somebody who is trained and knows how to talk to other people in the profession, but ran into lots of problems. And the problem that we all deal with is once you get home, there isn't very much support there at all. And so here's a person who is in a position to use her own personal experience to get those kinds of knowledge base, very much through personal story, into the curriculum.
Great ideas. Alan, do you want to say something about this topic?
Yeah, I think this goes back. Oh, I see Barry. I think this goes back to the educational process within these systems, and two, just when folks are on the job and they're getting 7 minutes with a patient, whether or not you have the time and energy to be able to focus on us the way that we should be focused on to bring better results.
Great. I'm gonna move on to another question. This is from Google Plus user Kate Ellington. Are there online tools that can help families and other caregivers share information, like open notes for caregivers? Sherry, you want to address that?
There are, through many of our organizations, tools and online communication processes that communities that allow to share some of these experiences.
This is Suzanne. Family caregivers can learn a lot by talking to other family caregivers, and so joining forums or chats. I know we have one at a forum at thefamilycaregiver.org, and because they're anonymous, it takes away some of the fear of sharing some very personal things. So I would definitely recommend our forum and other forums as well as a way of literally getting a conversation going.
Thank you. Our team member, Barry Jacobs, has been trying so hard to get it online. So I'm going to see if hi, and pose a question to him. The question from Google Plus user Chuck Pell: how can we design our plans to preserve the highest capacity, meaning independence and dignity, in each aging person?
I think we start by being as person-centered as possible, and that means really what their family and cultural histories are, and finding out how we can best serve people. What I often say is not all help is helpful, and so the help that is helpful is that help which is best tailored to who the person is in.
Okay. We're still having trouble with Barry. I'm so sorry. We'll get him to pipe in online later. I'm going to go to another question, which kind of.
Corey, do you want to have us address that question now?
Well, sure, Alan, go ahead.
Okay, I think where Barry was going was he was right. Is we have to get as personalized as possible on the path of care for each individual out there, and to be able to do so allows folks to age more gracefully, more independently, and more within a structure that allows them to feel and maintain control for as long a period of time as possible. That's not how the system is designed right now. I think if you allow the family caregiver to participate, if you educate them, if you provide them additional resources who might have greater expertise than themselves, you might start getting to a system that focuses on the individual as opposed to the system itself.
Okay, that's great. I'm going to get to another related question. What can we learn from the practical and emotional knowledge and experience of caregivers, which is different from that of the medical team. So what can we learn from the caregivers and pass on? Carol, can you address that question?
Sure. I think one of the problems in the healthcare system is that the professionals see one piece of the person, the illness, the part of the body that's affected, the moment that they're being seen, whereas family caregivers see the whole person and that person's history. And I think they see them through time. They're, in fact, I often say the family caregivers are often the only people who really know this person's whole medical history as well as social and personal history. So understanding from family caregivers how this person reacts to certain situations, particularly if there's a cognitive problem, how this person has reacted to crises before, can really be very, very important in devising a care plan that is important, that is, in the response to the previous question, person-centered, because you don't want a care plan that's only heart-centered. You want it to be person-centered, and that's what family caregivers can provide.
I think in order for it to work, we need to have the medical professionals respect the role of the family caregiver to provide information that only they can have, as Carol suggested. But until we're thought of as a real part of the care team, it's going to be really, really hard to have that information actually become part of the care record. And family caregivers also need education on how best to communicate with the professionals, and the professionals need better education on how to communicate with the family. It's like we work in parallel universes to some extent, and we need to better understand each other in order to really bring all the pieces together.
If I may, let me give a concrete example from our the United Hospital Fund's Transitions in Care Learning Quality Improvement Collaborative. When family caregivers were involved in medication reconciliation in a hospital setting or in a home care setting, going over what the person was taking at home, what their reactions were, often discrepancies between the medical, what's in the, quote, medical record and what the family knew, that prevented medication errors when that person was discharged. So that information is very concrete, very practical, and really very important in preventing a hospital readmission.
Can I just ask a question of the group here? Sorry to ask Corey. Is that an educational change that needs to happen? Is that a societal? Is that incentive-based? Because in my experience, even the best intention of the medical providers cannot take the time required to understand the 360-degree aspect of their patients. So even the best of doctors are having trouble getting there. So what has to shift first?
Money would help.
No, really, but what has to shift?
Well, I
think, Suzanne, do you want to go ahead? I'll answer after you.
Okay, thank you. It's a combination of things. Many of the programs within the Innovation Center that was set up as part of the Affordable Care Act have programs in which doctors are paid more in order to provide coordination and to be more patient and family centered. So, you know, Carol popped in and said money, and money indeed is definitely a part of it, because we can only expect people to do so much that isn't compensated. But recognizing that the coordination and the transition is where so many problems occur, that if we can fix those, then we'll be fixing a lot of problems at the same time. And as family caregivers learn to understand what it is they really can do, then you'll get, you know, more people really helping in the case of reconciling the medications. So again, it's bottom up and it's top down, and it's with the idea of readmissions and people hospitals and all getting a penalty if they have too many. It's carrot and stick, and we'll see where it plays out in the end.
Sherry, did you want to say something?
I just wanted to be able to add that I couldn't agree more with Carol and Suzanne, but this is really one of these bi-directional processes that really need to happen. To understand the value that caregivers can bring with information is absolute. To expect it always to be the physician is also going to be very difficult. That's why this collaborative team approach that we're looking at with the Patient Protection Affordable Care Act is so key. How do we work as a team to be able to incorporate that? And I think to understand that family caregivers are really the extension of the collaborative team that is working together in support of the patient's needs, and how to bring that to fruition is going to be key. And then, as so clearly said, to align the incentives, but also to align performance measures and the value that we bring in these outcomes. And once we can align that, then I think we can begin the process. And then I'm going to take one more deep dive, because we talked about that before. This also needs to go down into the educational system, that our students coming up understand how important this process is.
Absolutely.
Okay, I'm going to move on to the next question because we're getting short on time. This just came in from Twitter. The question is, what do we know about youth caregivers? The issue may be even less recognized than adult caregiving. Who'd like to address that one?
I would. There's an amazing program down in Florida, started by a woman named Connie Ford Siskowski, based on research that she has done. There are far more children who provide caregiving than we know, that people or even think about the fact that kids are caregivers. And it has an impact on them, their schoolwork, their own emotional situations. And the program that Connie has is actually through the school system to help kids manage both what they're dealing with at home, but still keep things up in school. And we need many, many more programs like that. This is really, really new territory. And once people see what's happening with a program like hers, hopefully it'll be modeled across the country.
Can I jump in on this? Because the National Alliance for Caregiving and the United Hospital Fund really did the first United States survey of young caregivers several years ago, and began to identify the issue that Connie has really operationalized. But we have many models. They are just not in the United States. They're in the UK, they're in Australia, they're more in Canada. Other countries have recognized this problem and have developed very youth-centered programs that allow kids to be kids, that allow kids to share their experiences with others because they don't want to be different from their peers. So there is vast experience elsewhere that could be adapted here if the will were there, if the recognition were there. I also want to point out that there is another group that is really hardly ever recognized, and that is young adults. People who are 18, 25 years old, starting out in life, still going to college, still finding a job, still finding a social place in life, and they are increasingly being involved in family caregiving. So they have different needs. They don't go to a support group with 50-year-old women and feel comfortable. So I think we need to recognize that the diversity of family caregiving and the needs that vary.
I was 28.
But I'm gonna move on to one more question because we're running short on time. These are actually two suggestions that came in from Nancy Fleisler on Google+. How about flexible spending accounts for caregivers? Similar to the employee benefit, give them a stipend to pay for small supports that make caregivers' lives easier and keep people out of the hospital. Or how about giving every caregiver a portable patient-controlled health record to make it easier to deal with multiple providers? Alan, what do you think about those ideas?
I think you'll see the flexible spending account over our lifetime, start expanding to caregiver. I'm hopeful that you'll see the tax code allow caregiver expenses the same way that they do dependent child care expenses. I think we all should carry around our own health record. We have as many health records as we have doctors. And I think as we work through these conversations, you know, every one of the suggestions here is great. It's going to take a decade to see how some of this plays out. In the meanwhile, if you're a family caregiver, you know, you just have to advocate for yourself, get in the middle of the situation, and if you can't do what you need to do and you don't have a single record, you have to find yourself a resource who can help you pull that together.
Okay, anybody else have comments on either of those ideas?
This is Sherry. I believe that Alan is actually right on key point, and it will take time. It'll probably take a decade, 10 years to pull this all together. But today we have family caregivers that need to be able to support their family, and you have got to take that advocacy role. And if you're not comfortable, please do look for those resources and individuals that can help you do that. You can't wait 10 years to be able to do that, and there are some things out there that can be done. One of the things from the provider side, if you're a provider listening to, we need to get comfortable that when patients do bring us, or caregivers bring us electronic records, either on a flash drive or in some type of a card, that we are comfortable in being able to insert and look at that. There is a tremendous amount of prohibition right now within our own industry as providers on what you can and cannot stick into a review, whether within an EMR or another system. We need to challenge ourselves to move and use our technology today that we have, and not keep holding that back as a barrier to being able to work closer with our patients and their family caregivers.
The issue of family caregiving finances has been around for a very, very long time, and there have been some initiatives on Capitol Hill over time to address it. The most popular one has been a tax credit for family caregivers. None of them have gone all that far. There is a group of us here in the DC area that actually is working right now to try and develop policy recommendations that are both practical and that really would help family caregivers both in the short term and in their own old age. So it's not a dead issue. It's like with all these others, it's going to take time, but it is very much on the minds of those of us who are dealing with how to make life better for family caregivers.
Thank you. We're going to take one more question that came in during our discussion. Here it goes. Do the panelists have advice for those caring for someone near the end of life? Specifically, thoughts about the role of caregivers in making healthcare decisions near the end of life? Carol, can you handle that one?
Well, I think that they're thinking about whether this person is appropriate for hospice, certainly for palliative care, which hospice is the only service that has the family built in as a unit of care. Palliative care does too, but it's not built, there is no home palliative care benefit with Medicare as there is with hospice. I think the family caregiver's role at the end of life can become very complex in terms of literally providing the care, because there's so many kinds of medical tasks that have to be performed, but it's also understanding the prognosis, understanding what is going to be likely to happen, who to call, where to get the kind of emotional support that the patient needs, that you need as a family caregiver, and being able to feel comfortable with a decision that you would hope have talked about with your family, so that it's a more or less agreed upon decision, and that the main thing I think at the end of life is comfort for the person who is dying, and comfort for the family that they can go on past this death and live and stay together as a family unit. I see so many families really disintegrating as a result of conflict over decision making, where it doesn't have to be that way. So it's a process, but it's a process that requires honesty from the providers, and thoughtful and loving care. those are the things you need.
This has been excellent. I'm gonna close this out and ask each of you to give a quick closing statement. Alan, can we start with you?
Sure. I got interested in caregiving because when I was sick, it was impossible to navigate the healthcare arena. And we all see it as caregivers. And everybody on this panel has been wonderful. And to the point Sherry made before, this is going to take a decade, if not more, for the things that we're talking about to become mainstream. Until then, advocate for yourself. And if you can't, find businesses and groups of people that can do it for you and can help you coordinate the process. I don't think you can rely on the medical system to do that for you. I think you have to do that for yourself and your family.
Thank you, Alan. Carol, go ahead.
Yeah, I think if we do have to think how long this is going to take, but Suzanne and I have been doing this for a long time, and the world has changed. And we wouldn't be having this conversation with this technology and this audience 15 years ago. So we've come a long way. We now acknowledge the role of family caregivers. We know what the problems are. We don't have all the solutions. So let's also, not feel too gloomy about the prospects of change in the future.
That's a great message. Sherry Latimer, please go ahead.
Absolutely. We have come a long way, and a lot of that attributed to the work that we've seen with Carol and Suzanne's organizations. I want to encourage all of our caregivers that are out there. You are a valuable resource, not only to the loved one that you are caring for, but to providers that are there. Advocating not only for your loved one, but for yourself, and taking that very proactive role is one of the most important things you can do. And to the providers that can be joining us, please remember what a valuable resource they are and how helpful they can be in helping with many, many options of not only directing the clinical care that's there, but the emotional, the passion, and the ability to be able to develop self-management skills. Together, we're a great team. Separate, it's going to be difficult, and I think if we can partner together, we could see some great results, not only in the quality of care, but in just the emotional stress we often see when there is a division in this process. Thank you.
Thank you. Suzanne, why don't you finish for us?
Everybody has been right on in what they've been saying, and I definitely want to ditto Carol's remark that we have come such a long way. It's baby steps in terms of what needs to happen, but the momentum is there in a way that it wasn't, 15 years ago. And I think that with the Affordable Care Act and the programs that are being put in place, that we will see progress much more quickly than we have before. Just the fact that family caregivers are mentioned in the Affordable Care Act, just as family caregivers are mentioned in regulations that are coming out. We've come a long way, baby, and we need all of you to be part of the effort to move us that much more forward. And thank you, TEDMED.
Thank you. Okay, I'm going to briefly summarize some of the key themes we've heard here today. We heard about all the factors that are making caregiving such an important issue these days. The aging of our population, we all move away from home, we're not close-knit families geographically as we used to be. Everyone's busy and the system can't quite handle the needs of patients these days. Employers need to be more flexible. They need to, especially moving down to the small businesses, need to provide that flexibility that caregivers need to be able to take care of their loved ones. This care needs to be person-centered, coming from the medical team to everyone else around the caregiver. You've got to personalize what needs to happen for the patient and the caregiver as well, who has special needs as well. There's got to be strong respect for the role of the caregiver, which our experts tell us we don't always see these days. We also touched on the fact that there are children and young adult caregivers who need special help. There are huge financial issues involved, and it's going to take at least 10 years. I think we're all being positive here to say that it's going to take about 10 years, but the momentum is growing, and what I heard is our panelists feeling pretty excited that good things are happening and we can keep the momentum moving forward. I want to thank our team members. I'm going to go by name again. I want to thank Alan Blaustein, Carol Levine, Sherry Latimer, Suzanne Geffen-Mintz, and Barry Jacobs. I'm so sorry that our technology didn't work to include you, but we hope to have you in a future TEDMED live event. Thank you for your time and efforts, and to everyone in the TEDMED community who watched and sent questions. If we didn't get to your question, there were some that we didn't get to because we received so many. Remember, the dialogue is always in session at TEDMED.com on the Great Challenges page for the caregiver crisis. We have one of these live sessions every Thursday, so stay tuned to hear what our next one will be. We've also got the TEDMED Facebook page, so please keep posting your comments and questions. This is all about opening up the conversation. We'll have another opportunity to discuss these issues when our challenge team gets together again for our next live event on the caregiver crisis in February. Finally, we want to thank the Robert Wood Johnson Foundation, who's the sponsor of the Great Challenges program. Thank you, everybody, for today's involvement.